everyone, and thank you so much for coming. We are so pleased today to present our webinar, The Power of Community, Advancing Family Stability and Collective Well-Being, that is being led today by Lutheran Services in America and Chapin Hall, but which involves the partnership, creative thinking, and action of so many others that we have the privilege of representing here today. I'm Julie McCrae, and I will be taking us through this webinar. To start, and so that we all get to know who's joining us today, please enter in the chat your name and your organization, and if you so desire, where you are from, so that we all know who is joining us today for the webinar. The webinar will be recorded, and each registrant will receive a copy of the presentation following the webinar. We are also very interested in your thoughts, your insights, your questions, your experiences as you tune into the information that's going to be presented and discussed. To do that, please use the question and answer function in the platform. We will use these questions, comments, and similar to guide our discussion at the end of our formal presentation. Our panelists today are Renata Johnson, Director of Children, Youth, and Family Initiatives at Lutheran Services in America. Myself, Julie McCrae, I'm a research fellow at Chapin Hall. Jennifer Gall-Stout, who is a researcher at Chapin Hall, and Jamie Reddig, who is joining us as the Director of Family Services at St. John's United. And we'll also have a special welcome. But before we do that, we want to get started by completing a poll. And for that, I will turn it to Isabel. When it comes to community building and mobilization, where are you on the journey? Go ahead and click on your answer that best describes you on the journey of community building and mobilization, and then we'll have the results shortly. Always helpful to have a poll, get to know each other a little bit, inform what we're talking about. So we really appreciate it. Okay, good. Oh, good. We have several that are eager to learn. That we love to hear that. That's right. We're also eager to learn. So we're all in the right space. And then we have others who are really applying some community building and mobilization, have been part of that, and are in that area of the journey. And then we have about 20 people out of those participating who have said that they are helping to lead initiatives, or maybe even leading initiatives, probably. And then we have a few on the call who are experts. So that's exciting. Thank you very much for sharing with us. And with that, I will introduce our special guest, who is Alicia Frericks, who is the President and CEO of Lutheran Services in America. And this will launch our webinar. Thank you.
Thank you, Julie. And it is wonderful to see so many of you here. I want to really thank you for joining us at this Impact webinar. When I look across the Zoom screen, I'm seeing so many of you here from across sectors and across communities. And that's what really community building is, that joining. So at Lutheran Services in America, our work and our mission is grounded in cultivating caring communities that advance health and opportunity for all. So achieving that vision means more than offering programs, right? And I think everyone here would agree. We believe that real, lasting change happens when communities lead and when organizations, like many of those of you here on the Zoom screen, help create the conditions for families to thrive. So across the country, communities are navigating real and complex challenges like workforce shortages, shifting funding landscapes, persistent inequalities, and deep systemic barriers. And yet, what we've seen over and over again is that lasting change happens when people come together with shared purpose, intentional relationships, and a commitment to working differently. So, through the Family Stabilization Initiative that's led by Renata Johnson here, and she'll take a little bit of a deeper dive in that, we've seen what's possible when communities build on their strengths and lead this work. And today we're going to talk about one of those key ingredients, building community. You'll hear about the frameworks we've co-developed with our partners, and you'll see it come to life through real examples and the impact that these examples have on people in communities. And as we dive in, we want to frame this conversation as both a reflection on what's working and a look ahead at what's possible, a chance to explore how community building is taking shape on the ground today and tomorrow. So with that, I'd love to turn it over to Renata to walk us through the Family Stabilization Initiative, the sites, and how community building fits into this work. Renata.
Thank you so much, Alicia. The Family Stabilization Initiative, or FSI, is a practical, equity centered effort to keep children safe and families together. Through FSI, we partner with communities to support families in crisis by delivering high fidelity wraparound while also strengthening the systems around families. So help comes earlier and in ways that really fit people's lives. Our shared result is clear that children grow up in safe, stable, permanent family homes, and families are supported by strong, connected communities. Our four Lutheran social ministry organizations participating in FSI are primarily based in rural areas like Montana, South Dakota, Alaska, and Washington State. Each looks different, but they share a commitment to accelerating the pace of change, to accountability, to centering family voice, to building local leadership, and really shifting from short-term transactions to long-term relationships that build lasting change. Community building is that connective tissue of this work. It moves us from things like delivering programs to families towards partnering with families. It creates the conditions for meaningful engagement, shared leadership, practical supports, not as abstract values, but as real strategies that help families and communities thrive. This shows up in many ways, but the key is that these aren't one-off activities. They're intentional strategies for weaving a strong fabric of support that really allows families to thrive and communities to care for one another. In rural communities, this work takes on a particular texture. Rural communities bring real strengths, deep local knowledge, dense relational ties, and meaningful community spaces like libraries, churches, small businesses, and even the local diner sometimes. But they also face particular constraints, including fewer service options, longer distances, and a stretched workforce. And we all know what that looks like. In these settings, community building, just like in other places, needs to be adaptive. Leaning into local assets, connecting with families in trusted spaces, and pairing local leadership with network support so promising practices really grow without losing their community roots. So through FSI, we amplify strong community-driven practices that are locally led and help strengthen, sustain, and scale them through the support of a broader network, and in this case, through Lutheran Services in America and our Results Innovation Lab. We know communities already have their own wisdom, leadership, and ways of supporting families. So rather than relying only on outside solutions that may not fit, the network's role is to amplify, connect, and resource what's already working, while also creating space for innovation that remains culturally grounded, locally led, and responsive to the unique context, rather than imposing like a one size fits all programs from the outside. The Results Innovation Lab supports this work through cohorts, learning convenings, and coaching. We help sites test small changes, measure their impact, and lift up what works so others can adapt it. So, our hope is that the framework gives you both language and inspiration to deepen the impact of your work, at just like we've seen through FSI, in ways that reflect your community's unique strengths and leadership. So, now I turn it over to Jen, who will walk us through what it really means to move from transactional to transformational. Because at the core of this work is how we show up in relationship with communities.
Thanks, Renata. So I want to kick things off today by talking about, like Renata said, something that sits really at the core of meaningful community work, and that is the shift from transactional relationships to transformational relationships. So a lot of the time, the way we work with communities ends up being pretty transactional. So someone comes to us with a need and we respond with a service, a referral, maybe a one-time program. It's an exchange, quick, efficient, and then we move on. And I mean, to be fair, there's nothing inherently wrong with that. Transactions can meet immediate needs, and sometimes that is exactly what's required. But if that's where the relationship stops, it doesn't really create much space for real change. So transformational relationships, on the other hand, are about going deeper. They're built over time on trust, shared goals, and mutual investment. It's less about what can we give you and more about what can we build together. And this shift is so important because lasting change in communities doesn't come from one-time interactions. It comes from strong, ongoing connections. We all know when people feel seen, valued, and included, they don't just show up for a service, they show up as partners, as co-creators, and that's when real mobilization happens. But this also means that we have to slow down a little. We have to listen more and make space for different perspectives and build structures that actually support collaboration rather than just outreach. So as we move through today's session, I want you to keep this in mind. Transformational relationships are foundational. They're what allow communities to move from reacting to problems to creating shared solutions and lasting impact together. And so as we think about building transformational relationships, it's also really important that we're all starting from the same foundation. And one place where this really matters is how we understand the idea of community. Community can mean different things to different people. It might refer to your neighborhood, maybe a cultural group, a shared identity, or it could be just the networks that you rely on every day. There isn't a single definition of community that fits everyone. And so that's why, for the purposes of this framework, we decided it was important to create shared definitions of community, community building, and community mobilization. Having this common language gives us some clarity, it can strengthen collaboration, and it helps to ensure we're all working towards the same goals. And importantly, a key part of this shared understanding is the role of lived voices, individuals with firsthand experience in public systems, because their perspective and wisdom are essential for shaping solutions that are grounded in real life experience and not just in theory. So starting with these shared understandings sets the stage for stronger partnerships and more meaningful community-driven change. And so now that we've talked about the importance of transformational relationships and having shared understandings of communities, we can look at how communities actually build and sustain momentum for change. At the core of strong, resilient communities are three key ingredients: intentional collaboration, inclusiveness, and a shared purpose. And when these elements come together, they can create the foundation for meaningful and lasting change. And at the heart of this work is a simple but really, really powerful belief that every voice matters. Community building and mobilization are not quick fixes, and they're definitely not one size fits all. They're long-term, adaptive processes shaped by shared values and grounded in real, trusting relationships. But meaningful collaboration doesn't just happen on its own. It usually requires a dedicated convener or a backbone organization to help guide and sustain the work. And this kind of organization plays a critical role. They hold the vision, keep people aligned, ensure accountability, and help disrupt systems that may have previously caused harm. They can also create a space for new community-led solutions to take root and grow. So in the context of FSI, for example, LSA has taken on that backbone role. But it's really important to know that it doesn't just convene partners quarterly. It really catalyzes momentum. And it does this by providing financial support, infrastructure, peer learning spaces, and hands-on coaching. And these supports help keep efforts grounded, connected, and moving forward over time. And of course, we realize that not every community has access to a formal backbone organization like LSA. That's just real life. And so that's totally okay. In those situations, peer networks can step in and play a really powerful role. So when community leaders, residents, and partners come together intentionally, they can share knowledge, encourage accountability, offer both emotional and strategic support, and really help to keep each other engaged when times get difficult. So these networks often become the glue that hold collective efforts together by maintaining momentum, promoting learning, and fostering shared ownership of the work. And so whether efforts are led by a formal convener or emerge through grassroots connection, what matters most is taking that first step, and it's committing to intentional action, creating spaces for authentic relationships, and being willing to learn and adapt together. Sustainable community change isn't about one organization doing everything all on its own. It's about working collectively, leveraging different strengths, and growing together over time. And so now that we've covered what makes communities strong at their core, we're going to take a look at the principles that take those ingredients and turn them into concrete action that lasts. So these principles are really the foundation of all of this work. They were co-created with participants from FSI, so they come directly from the people and communities doing this work every day, and together they reflect what matter most: collaboration, equity, and lasting change. And they guide how we show up, make decisions, and move forward together. One of the most important parts of community change is people-driven collaboration. So this means putting community voices at the center to create solutions together. And when we engage the whole community, we bring together different perspectives and strengths, and this helps us build stronger relationships than last. And it's important to note, it's not just about inviting people to the table. It's about valuing what they know and their lived experience from the very beginning. The effective work starts with listening and understanding what matters most. And so solutions that reflect local experiences and values are much more likely to work and stick over the long haul, over time. And it happens through practical approaches, which can include things like advisory boards or committees that guide programs and policies, youth and family forums, participatory budgeting so residents can decide how funds are spent, co-designing programs with community members, peer-led support groups, or mapping local resources together. And all of those approaches move away from top-down or bottom-up methods. Rather, they focus on shared power where everyone's perspective matters. Another principle is building on the strengths already in the community, because communities have skills, relationships, traditions, networks, and other assets. Focusing on these helps create solutions that are sustainable and grounded in local capacity. And some examples could include like resource hubs that bring services together in one place, neighborhood emergency networks that rely on local knowledge, skills sharing programs where people teach and learn from each other, long-term partnerships between governments, nonprofits, and community groups, cultural and community events, or youth leadership programs. Tapping into both traditional and non-traditional networks like churches, elders, local businesses strengthens relationships and encourages collaboration. And for community work to last, we have to build capacity, both in people and in the systems that support them. People and systems are interconnected, right? Strong leaders shape attitudes, leverage community strengths, and advocate for approaches that make a real difference. And this can take a lot of different forms. So like training and leadership development, sharing resources like meeting spaces or funding if possible, mentorship programs, partnerships across schools, governments, organizations, community-led planning, and supporting lived experience advocates, all really important. And by investing in both people and infrastructure, communities become adaptive and equitable and resilient and create systems that can really last. Shared leadership is about spreading responsibility across organizations, community members, and our people with lived experience. Strong coalitions thrive when everyone shares ownership and works together toward common goals. And so this can look like regular check-ins with advisory committees, led by people with lived experience, shared resource planning, transparent decision-making, flexible action plans, long-term relationship development, and celebrating contributions to sustain momentum. Shared leadership is not about titles or hierarchy. It's all about trust, collective ownership, and long-term commitment to shared goals. Finally, collaborative evaluation helps communities stay on track and make sure their efforts are meaningful. So accountability means setting clear goals with the community and then tracking progress using both numbers and personal stories. So evaluation includes co-designing goals, measuring outcomes and experiences, tracking trust and engagement, really importantly, creating feedback loops to adjust strategies based on how well they work, reporting progress transparently with the community, aligning resources with results, and celebrating successes while learning from challenges. So collaborative evaluation isn't just about checking boxes. It's really about growing together and making sure community efforts continue to evolve and stay relevant over time. All of these principles are interconnected, and together they create the foundation for sustainable community-led change. And so to help ground these principles in a really clear structure, we use a theory of change that illustrates how shared actions lead to meaningful outcomes for families and communities. So with that, I'm going to hand it over to Julie, who's going to talk us through the theory of change and explain in a little more detail how these pieces fit together in practice.
Thank you, Jen. And I'm going to take a moment to say, please put questions that you have, comments, anything that you are just thinking of as we're going through this. Go ahead and put those in the Q&A section so that we can cover that in the end. And your experiences, something that's resonating with you, all of that we would love to hear. And so as Jen mentioned, we put this all together into a theory of change to really describe the roadmap for how communities move from a vision to sustained impact in community building and mobilization. The theory of change really emphasizes connections among people, relationships, those relationships that are transformational, as Jen has talked about, and systems change. And you can see it's quite a busy graphic, but I encourage you to spend some time with it, reading through it, and to adapt it for your organization and community. So the theory of change starts with inputs, the people, partnerships, resources, as Jen also emphasized, dedicated, intentional resources, and building trust as inputs into your theory of change. This includes lived experience, your local leadership, funders, and collaboration spaces, spaces for people to be and collaborate. The change we have put forward here really begins with people and relationships. Next, we move into the principles, which is the next layer of orange, the second one down that we just talked through. These are principles that in the theory of change that guide our actions and how we do our work, including that people-driven collaboration, asset-based partnerships, capacity building, shared leadership, and collaborative evaluation. And note that this, in our principles, shifts our emphasis as service providers or adds to our emphasis as service providers from doing for to doing with. Our outputs then, the next circle that you see on your screen, is when we act with these principles and with the resources to support our actions, we see outputs, including stronger relationships, stronger consistent, sustainable relationships, more confident leaders, clearer goals, and more connected networks. And finally, the outputs lead to long-term outcomes in communities that solve problems locally. They use their resources more effectively and include multiple voices in that decision making. And families get support earlier and not just at the point of service, as we mentioned earlier. This is more likely to reduce crises and unnecessary child welfare involvement that Renata had mentioned earlier. So with that, I want to just emphasize too that this is a continuous cycle of learning. It is adaptable for your community, and we will have more to come as we continue to implement this work in multiple communities throughout the United States. So with that, I'm going to switch us over to our next panelist, and that is Jamie Rettig. Jamie is the Director of Family Services at St. John's United, which is a network of human services with a history dating to 1958, serving families throughout Montana. Jamie will take us through her and her team's community building and mobilization experiences that's resulted in strong, consistent, and resilient networks to support families. And as you hear her story, please take notes of areas in her work that highlight the principles we've discussed, the theory of change, and the framework that you've been learning about. And go ahead and type those in the Q&A, a reminder.
Thanks, Julie. It's very good to be here with all of you. I don't know what time it is where you are, but it's still morning here in Montana. As Renata said, Montana is a part of the FSI network, or the initiative to help families be stable. In Montana, we're doing that through high fidelity wraparound and a program called CARES. So when we started this program, gosh, 3 years ago, almost 4 years ago, we started seeing families. It was I came in with a lot of experience in community, just knowing where I had lived, what community meant to me. I'm from a small town, so understanding that without each other, things don't work very well. And then I moved to a large city and had to kind of build my own community again and find those people, and again, understand the supports and the things that were needed. And during that time in San Diego, I worked in residential. And we took really good care of kids. They were kids ages 5 to 12. We invited families into, those special holiday events sometimes, things like that. But looking back, what we didn't do really well was invite families into a community and build on that and grow that and help them build better relationships in a different way with their kids. And so when I came to St. John's to start this wraparound program, it's a different kind of program for Montana. There is a lot of in-home services and things like that happen across the state, but high fidelity wraparound is very intentional. It's very community-based. It's very family voice and choice and strengths-minded. And we have that time to be intentional with families. So one of the things I did when I started building my team is I was very intentional about the people that I hired for this project, for this process. And I know that's kind of difficult in some worlds, right? Because we don't always have a lot of choices. We don't have a big group of people to pick from or hire from. Particularly, it was worse during that time because we were just out of COVID. But when I say I was intentional at looking in how they talked about community, what was their community, what was important to them, what were their experiences, and you can just kind of tell like where their mindset was. I think there are a lot of different programs and a lot of different social services areas that work with families, and we've all had experiences where you're not always left with a great feeling, and you're left wanting something better for families. And so that was kind of the beginning of this whole framework and building on community is just with the team. And so once those one by one they were hired, and as one was hired, they got to sit in the interview for the next person that was hired, because that was also important in building their community. They're going to be a community, a team together working with families. And so it was important that they could feel like they were a part of building that team, and also that they had some good vibes together, which is also not always, perfect formula, but in this case, it worked pretty well. And so they've actually given feedback that it was only one time did I not have them sit in an interview, and I made the choice. And I can tell you that person's not here any longer, just because it wasn't the greatest fit. Not a big deal. She moved on to a new thing, but it did make a difference that they participated in that. So as a team, once we got that team gathered, we set out some goals and intentions for ourselves. What did we want for families? What did we know about families? And what did we notice over our careers? A couple of us have been doing this for 20 plus years, and we've seen a few things. And one of the themes that kept coming up for us was our families are isolated. Even in a community full of people, they often feel isolated. They don't have a lot of connection. They're super overwhelmed, and some of them have burned bridges, whatnot. And so we set a goal that we really wanted to build some sort of connection and community for our families, that no matter if they were in our program or not, if they had graduated, if they're just beginning, that they could be a part of that maybe they could find some connection, that their kids could find some connection. So we set that as an intention and a goal. One of the other things we talked about was just what's in our hands already. Sometimes we overcomplicate things. So what do we know already? Who do we know in the community? What sort of strengths do each of us have that we could bring to the community? And so we kind of set those aside, and we thought about, again, like, how do we bring people together? So for us, we decided that we had the ability to do some events and some bringing families together in that. And so what would that look like? Once we decided to do that was a way we could try. And let me tell you, we tried a couple of things to begin with, just with even letting the community know we were here. St. John's United is primarily known for elder housing and assisted living and all of those things. And so our Families Services department is a little bit smaller. And so even just to reach out to our community, I remember one of the first things we did is we went over to a local coffee shop that is on the south side of our town, and they're working to kind of rejuvenate it, and they have an apprenticeship program with it. But we talked with them, and they gave us permission to sit in there and just talk to people. And we bought people's coffee for like an hour, which you would be surprised. Some people were a little nervous about that. Like they were signing up for some sort of, I don't know, that meant they were signing up for something, and they would run, or they wouldn't wait, or they would kind of hide in the corner and not make eye contact with us. And so we kind of just started that way with letting community know. So simultaneously building a team. And then the other piece of it is we're recognizing, who do we already know in the community? How do we start talking about our program? How do we start building those referrals? And what are things that we could try? And so my team came up with the idea of going to the coffee shop, and I said, sure, what could it hurt? And so it was a unique experience. And so we just kind of started with that. But one of the agreements that we also made at the beginning was this: no matter what we did, whether it was an activity, whether it was community, like sitting at that coffee shop or doing a tabling event, we've all been to those where we talk about what we do. Even if one person came to our table, or only 5 people at the coffee shop came, or one family showed up for an event, we were going to be okay with that. It wasn't going to be one and done. We know that our families need consistency. They need, in order to build that connection, in order to feel like they could trust us, they need to know that these are something this is going to happen consistently. We're going to be able to show up in this safe space. So we're starting to figure out those events and those activities and what could those look like. In the meantime, we're still working on referrals because, again, we're a new program. And so just thinking about intentionally, I said, I have a great relationship with some of the people at the school. We have a very large school system, the biggest in Montana. So it wasn't a blanket like email to all the counselors and all of the teachers or all of the principals. It was, Jamie, who do you already know? You've worked in this school, you've worked in this school, you've worked with this administrator. And so it was kind of one by one setting out and talking to them about cares and what wraparound could do for families and in our intention. And so we could start building some referrals in that way. And then one by one, different members of the team kind of talking about and talking to people they already know. I think one of the things that we've all experienced as well in this system of families and children, and often child welfare can be involved. And it's a goal of ours to not have that. But oftentimes it is. I think sometimes we can meet a lot of, I don't know, barriers. We've always done things this way. Sometimes not always strength focused. A lot of what's going wrong with the family, what the parents need to do. And we had the opportunity to be kind of intentional about some of our language. And we also decided together that we were going to really focus on those agencies, those partners, those people in our community that were like-minded, that believed in families in kind of the same way we did, that understood that strengths were maybe a better place to start with families. And so that was just kind of our effort to start building in those referrals and also to start building, I think, our own little service community that could have the same languages for parents. And so that looked like the school system. And then it looked like I work with CASA of Yellowstone County, and we're working on some trainings together. And so their advocates are trained in a certain way. And then my team is trained in that way. And now we're looking at our caseworkers want to have that training and some of the judges. And so that happened over a course of probably like 2 years of like intentional, like how can we work together in a positive way. So these things are kind of all happening simultaneously, building those referrals, building those community partnerships. We had several community like luncheons where nothing was expected, but just come and talk to each other. That was another thing that we noticed as a team. And then as we were talking to other folks in the community, is that a lot of times we don't have time to really be with each other. And this is hard work. And so a couple times at the beginning, it was really just come and eat and maybe get to know someone new or just have 30 minutes to breathe. And we kept hearing over and over again, like, wow, we haven't done that in forever, or that was really nice. So we continued to do that. We started holding then events as we built up our referrals, and we started to have some families that were consistently in part of our process and then graduating. And so I think our first like official family event, because one of the other things that we know is that food brings people. If you don't have food, people aren't going to come. And also we wanted families to be able to just like spend some time having fun together, like no stress, like we'll plan everything, just come be together, no expectations. Like you don't have to, again, you're not signing up for some lifetime of me bugging you. You're just coming to be together. So our first event, we decided to do a bingo night, and the young kids on my team didn't believe that bingo would be successful, but I say it reaches across all ages and everyone can play, whether you're 5 or 75. And I think that first event, we probably had 25 people. So probably like 5 families, because one of them was a family of 8. They had 6 foster youth, I think. And that was the first time they had been out of the house in a very long time. That foster dad came up and said, "Thank you that was so much fun." And I was like, really? So that was kind of where we started. So we always go back and evaluate. Um, the process, like how did it go? What did we do well? What could have been better? What did you notice? So we were doing that as a team. Um, we decided after that that if we're going to do that, we need to be, again, consistent. And so we made the decision that we were going to hold quarterly events. We're not just going to have the Christmas party or the Thanksgiving dinner together. We're going to have every 3 months some sort of activity where families could be together, do activities, eat, hopefully connect with one another. So that was kind of how that process started. Over the last year and a half, we have managed to do that fairly well. Each time going back and looking at like what went well, all of those sorts of things, and then shifting. We also started looking at like what's in the community, who's in the community that our families don't necessarily get to utilize. So like the water park, it's expensive. And if you have a family of 4, you're a single mom. So we have some funds that could help with that. And so we've took them to the water park. We've taken them to the zoo together. Again, all families together. What we started to notice after probably the first 3 or probably 3 events, kids started bringing their friends, or they invited somebody from daycare. And so us as a team were looking around going, do you know who that person is? Do you know who this family is? And so they started connecting in that way. We started to notice that the kids that were coming to our events were friends. They knew each other. And so that was what we were serving. It was working, right? Because the whole thing was to build community and connection for one another. After the first year, we decided that we have peer partners as part of our wraparound. And so we have 2 family peer supports that work with families. They have lived experience. And so we also decided that we wanted to start a parent advisory committee. And so that became part of what do we do next? Like, this is great. We can imagine that what families need, but let's really bring in the families. And so we sent out applications to some of our graduates this last year. And in April, we started a parent advisory committee. They meet monthly together. They are a very unique group. There's a single dad, there's a single mom, there's kids, moms with special needs. They're just a good solid group of just differences, and so they bring different perspectives. And so then they started to speak into like our events and gaps and what's missing and what's going well and what do families need. We started working. There's a business in town where it's an inside play area. It gets cold here, and so we also partnered with them. And so we've done some coffee meetings there, or just meetings in general where kids can play because it's an indoor area, and there can be some sort of connection with adults happening. So we started to also look at businesses and bringing them in. One thing I think sometimes in nonprofit, we assume that people are going to donate things all the time and that we can just get the stuff for free, or maybe that's our hope because we really need that money. We were able to pay them some, they donated some. So we've found kind of a good relationship, and those relationships continue. We just had an event last week, and out of that business I was talking about, Monkey Around, we had somebody come and do like little paintings of all of our kids and families last week. And that was a connection made through this business. And so we continue to we have a list, and our parent advisory committee keeps a list. Here's resources, here's places that families can go, and also here's people that could support our families or come to our activities or be involved in a different way. So I think that continues. We just had an event last week. So we started, what did I say, with 25, maybe 22, the first, this event we had last week. I think there were about 100 families and their friends. We have again noted that they start bringing their neighbors, they start bringing other people. One thing I didn't say, but we were intentional too about reaching out to our public health organization that does parents as teachers and family nurse partnership. And so our care coordinators and their care coordinators meet together. They kind of staff and support each other. but then also their families can come to some of our events because they're the same type of family. They're the same families looking for connection. And out of that, we've also gotten referrals. And I think last week we probably had 6 or 7 of their families, which I tend to call them our families, but just to differentiate. And then I think we also got like 3 referrals from that event because there were some kids and moms that in particular that event that needed some extra support. So we were able in that moment to just kind of nudge each other and say, hey, let's talk next week about them. So that's kind of how it's progressing. And our parent advisory committee is led by our peers. And it continues to, they looked at the event last week, and I have a list on my desk. I just got back from a trip, and they've made new suggestions and things we forgot and things we could have done better. And they're already talking about their next kind of event. They've also done some smaller connections, like if we have moms with special needs, kids or dads, they've brought them together in smaller groups. And so now what we're seeing is even our parent advisory group is asking for more training and more, how do we become better lived experience or how do we increase our lived experience to lived expertise so that we can support people in different ways. And so you're almost building in future staff, future team, but also they have a passion for it, which is what they all needed to start with, in my opinion, kind of at the beginning. And so that's kind of how we're progressing. And I think in there, you probably heard me say a lot of times, very intentional. And every mistake that was made, because there are mistakes made all of the time, like it was an intentional learning opportunity. Even if it didn't feel good, even if it was hard, we've really tried to be intentional about what can we learn from this. Also, I want to say too, we do quick surveys at our events. Why do families like coming? What is it about? And those have gone really well. It's just a quick, like 2-minute thing, and they put it in a bowl and they get a gift card. We draw and they get a gift. So there's a little bit of an incentive if they do it. But we keep trying to find different ways to have our family engage and to have them build their own community. So I think that's kind of what I wanted to talk about that's going on here in Montana. So
I really love that last piece as an evaluator, as a researcher.
well, I mean, I just, again, I think it can be really easy to
Right.
become the professional, and I'm the clinician, and I've been doing
Right.
this for years, and I know this is what somebody needs, or this is what I would need.
Right.
And so we've really tried hard to live what we say, and let's really add. And we've had some feedback, like this could be different, or we would like it if you do this different. But we've also had that great feedback, like I belong here. I don't ever feel like I'm not wanted. I feel like I can come here anytime. And that was our goal at the very beginning, like a place of belonging for anybody. So it's in our building that we share with several other departments. And now those departments are putting their gratitudes, their clienteles and families are adding that. So that's also built a community within our building that just keeps kind of
Wonderful. Really quite a journey that
going.
you've been on.
So it's been fun.
We really appreciate it, Jamie. And I want to acknowledge that I can already tell we don't have enough time for questions because I know I have multiple questions. I'm not going to ask my questions. We'll focus on questions that have come in from the audience. And so want to get those covered. So excited that a lot of this is resonating for folks. So our first question has to do with the learning community for this. And so Heidi, if I might just mention that you had said that the information is really timely for an initiative that you're starting or some work that you're doing. And so they'd like to use the framework as a foundation and asking about learning community opportunities. So I will turn that to Renata.
Yes, I think it's an amazing question absolutely is a learning community around this work. Our Family Stabilization Initiative, like I said, is a broader part of our results network here at LSA. And we really bring together organizations, particularly our social ministry organizations in our network that are committed to centering families, building strong support, and having them be around the coaching, the convening, and things like that. So if you all want to get in touch with us, we can definitely do that. But what I would say, and it's a little bit of what Jen talked about, is there are opportunities to seek after organizations like us, and there's opportunities to build your own learning collaboratives where they don't exist, because we think that there is a importance for that particular role, so that you can have people that lead you in challenging your assumptions, in accountability, in asking about data, in evaluating data, and things like that. So we would also encourage you to look at who's in your community, who are, in talking to Jamie and preparing for this. One of the things that she talked about is who are the people that are like-minded. And so are there some like-minded people in your community, if you're not able to partner with a national organization, that you can create a community with, that you can create a learning collaborative with, to really talk about these things and support and expand what you can do with families together. But we definitely would love to link up with you and share some more information about what Lutheran Services in America can offer.
Thank you, Renata. I will go ahead and have this next question, I think, is also directed to you. Just a little bit about the coaching that's occurring with the effort.
Yeah, the current coaching that we are doing right now, it's also because many of our sites are implementing high fidelity wraparound. So there's coaching around that, but there's also coaching in different levels of leadership that is connected to the organization. Many times what we've seen is that the coaching sometimes is with the supervisor who is supervising those that are doing direct service. But we know that there's a system, or we want to create a system, an ecosystem, a community around this particular program, because it's not only about that one service that's being delivered. So there's coaching that's happening at different levels. And one of the frameworks that we use here at Lutheran Services in America is the results count framework. And so being able to do that, being able to look at things from an equitable lens, accountability, all of those things. So that is kind of what frames the coaching that we have. And so we have monthly cohort meetings, but there's also individual team coaching that we have with the facilitator, even with people that are the founders of the model, or in some of our other programs with the data person, just different things like that. So hopefully that answered your question, but also understanding that communities and teams are different. And so thinking about, how we're doing it, but also figuring out what would be the need and what would meet the need for that community or that particular program.
Great, thank you. We have another question around the Parent Advisory Council for Jamie, I believe. And so the question is, do members of the Parent Advisory Council participate as support for the events and activities and some of those other areas that you were talking about, that they're advising as well? So do they kind of do double roles, if you will?
Yeah, so they meet monthly to just they're doing more than event planning, but so they meet monthly, and then they also attend those events. It's not a requirement, but they love going. That was part of when they applied, they knew there was going to be some time commitment. They are reimbursed for their time, and so they are there. We've done some tabling in the community. They participate in that as well. So they and their families attend also those events. Yes, they are compensated. I see that there's a question that came in. They do get some compensation for their time with us, because it's also very important to me that we value their time in that way.
Mhm.
My
Okay.
staff also attend those events. That was part of our agreement at the beginning. That's just part of their work and day. And they get to flex their time, whatever it may be. But that was also, we're all in it, or we're not. So I'm there, the team's there. And then the parent advisory committee is now also participating.
Okay, great. And then, so someone's commenting on implementation science. Perfect. There is one clarification. Someone's asking, can you define high level? I'm thinking that maybe it was Renata when you were talking, but if you don't recall exactly what that was referring to, can you define high level?
It could potentially be talking about high fidelity wraparound. And so if it's talking about that, then there are organizations that are incorporating the wraparound principles in whatever it is that they're doing. And then there's organizations that are implementing high fidelity wraparound itself. And it is a particular model, a little bit more intensive and directive in how you support families.
Thank you. Okay, so that concludes the question and answer period of the webinar. We've got 1 minute. Renata, I know you want to wrap us up and just discuss a little bit about common themes and other resources.
Yeah, I just wanted to, as we wrap up, I just wanted to be able to leave everyone with what we learned through this particular FSI. And it was that you don't have to save the world all at one time. You know, this takes time. Community building is not about checking a long list of activities, but it's really about finding that through line, those 1 or 2 intentional activities that can really ripple across multiple principles and create that real change. And so, as I heard from Jamie, there's many different strategies that she described, but so many of them fall under several principles. So it's not the checklist. I do this principle to do this, and then do this principle. It's so interconnected. So I really encourage everyone to start where you are, be willing to test those assumptions, try something new, and really step in your role as change agents with intention. Each of us have a role as a change agent in our community, and it doesn't take doing everything all at once to make a difference. It's really about those few focused actions done well and with intention that ripple across the principles. So that was my takeaway from this, and wanting to really share that with others.
Great. And you can see the contact information on the screen. Feel free to reach out. We've enjoyed having everybody here, and we will send out slides from the webinar. Thank you.